Okay, and here we are. I'm going to give everybody just a minute to continue to join. Thank you everyone for being here on this lovely Tuesday, especially given the holiday coming up. I'm just grateful that we are having a wonderful session and for everybody's participation. Hope everyone's having a good week. Okay, and as folks continue to join, I will just go ahead and kick us off. So again, thank you everyone for being here for another session hosted by the California Telehealth Resource Center. Always happy to be hosting wonderful subject matter experts and bring the latest digital health education that we can. Today's session, we have a really exciting presentation and wonderful host. Today is Trailblazing Healthcare Education, Digital Innovation, Telehealth, and Training. I'm really excited to introduce Nupur Hajalia, Dr. Nupur Hajalia, who will be giving today's presentation. And also congratulations to her for her recent awards I've been seeing on LinkedIn. So we have a really exciting day. Next slide. So a couple reminders before we get started. Everyone has been placed on mute as you've entered. We'll continue to leave you on mute for most of the session as the presentation is given. We will, though, encourage you to turn on your video if you'd like. We'd love to see your face. It's always helpful as we're presenting to see some faces listening in. We also will let you know to use the chat as much as you can throughout the presentation. If you have any comments or questions for our presenter or for CTRC, drop them in the chat, and we will have some time for questions at the end. And then I'll be available in the chat if you have any technical questions. Today's session is being recorded, so if you have to step away for anything or you would like to share this information with your colleagues or revisit it, it will be available on our YouTube channel, most likely by the end of the day, if not the end of the week at latest, but it will be recorded so that you can revisit it. And with that, I would just like to go ahead and transition to offer Dr. Nupur. The floor is yours, and thank you for being here.
Thank you, Eileen. Thank you so much. And thank you to CTRC for giving me this opportunity. It has been an amazing journey from the time that I started, using telehealth. And I must say that CTRC has always have excellent resources for somebody who is really new in this game, and also to people who are kind of building their portfolio in the arena of telehealth and digital innovation. So kudos to all the team members and Ochin for kind of supporting CTRC. And I'll get started and let me share my screen. So a little bit about my journey. I have been in the area of rehabilitation for past 20 years. I started my journey as a physical therapist. I am also a licensed clinician and provide physical therapy services in California. I'm licensed in California and Washington. And I am a neuroscientist by training. So I kind of have different hats that I wear at different points in time that gives me a very unique lens to look at healthcare as something that, it keeps evolving, and we have to kind of keep innovating and changing our techniques and approach. So I did my PhD from University of Minnesota in rehab science, emphasis in neuroscience, and then moved to Feinberg School of Medicine to do my postdoctoral fellowship in clinical neurorehabilitation, working with people with incomplete spinal cord injury and stroke. From there, I moved to Rosalind Franklin University, being an assistant professor in the Department of Physical Therapy. And now here I am at Fresno State, working in the Department of Physical Therapy as the assistant professor and also the director of rehab technologies and outcome research. So digital innovation and technology has always been on my mind. And I think off late, I feel that I'm also getting into excited about advocating for policy changes in the area of digital innovation. So my talk today here is Trailblazing Healthcare Education, Digital Innovation, Telehealth in Training. I'm going to take three aspects or approaches to it. One will be from the perspective of a provider, and second will be definitely from the lens of an educator. And finally, I think a technology enthusiast. I feel that the area of physical therapy, not just in the scope of healthcare, is evolving, and I feel that me as a healthcare educator needs to kind of step up and make sure that my students, who are the future healthcare providers, are in line with what the technology has to offer. So I feel that we have to be, I would say, very interested in kind of how we deliver that and make sure that we have guidelines and we have curriculum development around technology. So my mantra is educate, engage, and empower. I feel that the next line and the next generation of healthcare providers will have to step up and do something really exhilarating and interesting in the field. And they have all the tools, I think, and we as providers of education have to give them those tools and make sure that they know how to use it ethically and responsibly, so that we can help our patients, who are the end kind of users and takers of what we do in terms of delivery. So my mantra, like I said, is empowering people, and that in this particular case are my students. So I did give you my bio. Few more things. I'm also the vice chairperson of San Joaquin Valley District, California Physical Therapy Association, which means I get to advocate for healthcare equity and healthcare access for underserved and marginalized population. And if anyone is interested in connecting with me in those areas or aspects, I have given my email address. You can hit me on LinkedIn too. I'm very active on LinkedIn, and Eileen kind of know that. And so make sure that, if you're interested, we get connected and move this profession and this area forward, and make sure that our healthcare providers who are in the pipeline are being guided in the right direction. So talking about telehealth and digital innovation, I feel that now this term, this technology, and this medium is kind of, people are aware about it. It is not a very alien terminology. If you would have asked me 15 years ago, yes, people were not kind of sure of it. But, the pandemic actually really catapulted into the main domain. And it's a very important aspect to understand that telehealth is health. It is not a subsidiary, or it's not a subsidized, and it's not, I would say, an adjunct to what we do in health. I feel personally that for the continuity of health, telehealth can be a great resource and medium, so that the care that we are providing to our patients is not in silos. There is a continuity of care when we are not seeing them in person in clinics or in hospitals or in skilled nursing facilities. So digital innovation has kind of really led us in this direction of making sure that our patients feel connected with the providers from time to time. And I feel that telehealth can be a part of that puzzle, that piece of that puzzle that can really help us in that domain. So from the World Health Organization, telehealth involves the use of telecommunications and virtual technology to deliver healthcare. And it could be from a variety of medium that you can use that, whether it's synchronous or asynchronous. And when you're thinking about the modes of telehealth, I think it is very important that we also consider what is called as, and I'll be touching upon that, in terms of remote patient monitoring. So whether it is clinician to clinician, clinician to patient, or using some aspect of mobile health technology, I personally feel that it is very eminent and very important that we make sure that healthcare providers who are next in line are very comfortable using such medium to make sure that their patients are kind of getting better and we are reaching those outcomes faster. I think time is essence in terms of healthcare. And that is something I think I'm trying to achieve and optimize, is to, from the day I see the patient, what are the outcomes that I'm tracking and what are the outcomes that I can show that my client is improving, not just from the insurance perspective, but also from the aspect of a healthcare provider. So in terms of unleashing the potential of technology, and in this particular case, telehealth, I want to talk about personally my experience with telehealth simulation in healthcare education. So some of the questions I want to pose to the people in the room is, how can technology redefine healthcare education in terms of the methods that we are using to align with the demands of modern healthcare? We know that we are having this concept of value-based care. We are aware of the concept of home health, and kind of taking the hospital to home. What are the things that we can do in terms of preparing clinicians who are kind of making sure that they know how to kind of deal with the evolving landscape of healthcare? So what role do practical skills and real world experience can play in preparing the future healthcare professionals? We do know, for example, from the nursing aspect, there's a lot of emphasis on simulation, but how can that aspect be translated into a modern healthcare space where we are talking about hybrid model, right? So how can telehealth simulations be part of that, preparing the clinicians in those particular aspects or domains? I will also touch upon my approach to interprofessional collaboration and practice. I have been, I would say, a great advocate for interprofessional care. Recently, I was awarded an interprofessional research award from my college for kind of providing that interprofessional care to underserved patient population through a team of interprofessional care providers. So again, I think I want to kind of pause and let you kind of think, if you haven't tried that model, what could be your next best step or next step in your approach to using some of the interprofessional collaboration model, which I think is another way to kind of tap into that evolving healthcare education landscape. And finally, I want to also talk about the digital innovation in healthcare and my personal journey of how I am imbibing some of those. And I must say that, with innovation comes challenges. With innovation comes sometimes being not sure of where you are landing and what you are kind of getting into. But I personally feel that, unless you try it, unless you do it, you'll not realize the pros and cons of the process. So if there are people in the room who are excited about telehealth but have never tried it, I would say that either you can reach out to me to kind of help you guide you, step by step, or I know that I have seen the CTRC website where they have some excellent resources for first-time kind of telehealth providers. So in terms of telehealth delivery and healthcare education, my success story goes, again, from the time of the pandemic, where I had to kind of really flip my on-campus clinic, which is the Gait Balance and Mobility Clinic, for which I am the director, into a telehealth model. And I would say that initially there was a lot of hesitation that kind of comes with when you have not tried the medium, right? So if you imagine physical therapy, you would always imagine physical therapy being in person, very hands-on profession, and very direct patient contact type of a profession. And we found, during the pandemic, that we were able to really revolutionize the way that we were approaching patient care. And we had patients with Parkinson's, with stroke, with gait balance and disorder, with vestibular disorder, with traumatic brain injury, such as concussion. And we found that those patients were ready to try telehealth. And the reason being that I felt that we were able to make them comfortable by A, speaking to them, and B, kind of giving them videos and helping them learn what telehealth is. And then C, we didn't start obviously treating the patients right away. We did an orientation. So if somebody is, again, starting off new, I feel that orientation can go a long way. You can have even telehealth coordinators who can coordinate and make sure that, either the online access or the portal or the digital platform that you're using, the client is comfortable with it, and you can orient them. So my advice would be that if you have a clinic and you are always doing things in person and want to try telehealth, maybe have those introduction or the orientation sessions with clients and families, have pamphlets, have ways in which they can get themselves accustomed with the medium so that they can try it. So in my case, I'll talk about this recent research study that was published, which was the study done during the pandemic. And this is the telehealth implementation and teaching strategies for gait balance and mobility clinic in community dwelling older adults. What I found through this study, which was published in Topics in Geriatric Rehabilitation in the month of November this year, is I actually talk about both the aspects of delivery. I talk from the perspective of a clinician in this paper, and also from the perspective of educators. So you will find gems in which you can take framework of delivering care for a 2-month model, twice a week. So it's kind of you can think of it as a recipe that we have tried to create if you want to go from session 1 to session 16. And again, I mean, this is used from the lens of a physical therapist, but I feel that it has abilities to translate into other professions too, in terms of the model that you can use to kind of create your own, I would say, delivery mode. So we kind of showed that you can take outcome measures from, we wanted to do a usability outcome measure because this is called the Telehealth Usability Questionnaire. And we were interested in kind of knowing whether the patients are okay with the telehealth, what do they think of it, this medium. So we did a telehealth usability questionnaire from an initial evaluation to final discharge. And we definitely saw that, they were kind of, they kind of hit 139 out of 147. But, there was a time when, the technology didn't work. It kind of went back to 136. So the point being, and the takeaway from that score is that if the patient doesn't have a good experience in terms of connectivity, that their experience kind of drops back, because that is the only way that they can probably connect with the provider. So we thought from that, we learned from that. And what we learned was that there has to be a continuity of care. So that is what I think I take away from this, is that if you are providing telehealth, and if you think that there could be a way in which you can use remote therapeutic monitoring, which I'll talk about in the next few slides, that's a great way of knowing how the patient is doing. And it's not just one time on a digital platform that you're using, you're knowing on a day-to-day basis how your client is. But we did gamut of, gait and balance outcome measures. And we try to kind of do balance assessments and gait assessments from pre to post, and saw some really good changes in this patient population. I also kind of provided for obviously the physical therapy aspect of what exercises people can do, because again, from this profession, which is very hands-on, initially the clinicians were not sure what they can do via telehealth. So again, this kind of gave them an idea of what are some of the things that they can do from session 1 to session 16. So in terms of virtual clinical learning, as a healthcare educator, you can have a discussion board activity, you can have a peer observation and evaluation. So we kind of divvy the students in a way in which we had students delivering the care and also students observing how the telehealth was delivered, so that they can give their peers an observation and evaluation of what are the things that they thought was seamless, but also what are the things that they thought were challenging for the patient. For example, we in California, we have a big population of Hispanic patient population. So how would you navigate that? Do you have a provider which kind of speaks the same language, or you can have a way in which you can have an interpreter? So I think those are the things to think about when you're thinking of doing telehealth session. And finally, in terms of assignments, given that this was actually a service learning course, the students were able to kind of reflect upon what are the things that they learned, what are the things that they would like to kind of change when they are performing a telehealth session. So it became a very enriching experience as a whole. So this part is telehealth in interprofessional care. I kind of learned from the W Health organization that learning together to work together for better health model is something that I was really excited about to try. And what we did was we had a team of clinicians and providers and in my university, where we use physical therapy, public health, nursing, and social work. And in terms of interprofessional team, we designed a telehealth simulation in which our students were providers for the healthcare, for this providing healthcare access to the community. And what we found was that in terms of simulation, when we were providing simulation, we learned from the students that they really enjoyed the debrief session. They really enjoyed kind of evaluating and learning from and how that they have to perform telehealth. So in terms of telehealth-based, I would say, simulation setup, what I learned was that though we were kind of having three, I would say, providers, we made sure that we had we did a pre-post assessment of how students felt as part of this telehealth simulation setup. And what we found was that in terms of providing or having a patient setup, it's important, again, to do an orientation before you even get into that simulation aspect to it. So here we were simulating kind of using a Parkinson's patient discharge kind of model. We wanted to see how the students interacted, whether it's with physical therapy, nursing, and social work education, and kind of make sure that, what are the things that they can talk about from the aspect of each of the providers, whether it is physical therapy, what kind of exercises they can provide. For nursing, what are the things that, they can talk about. And then in terms of social work, whether it is financial or social factors that they need to talk about. What we learned was some really great learnings. I would say one of them was that telehealth session, only 46% of them, and I'm talking about the students, had telehealth sessions. So this experience was really valuable to them. In terms of, we asked them, do you have a prior experience doing telehealth as an interprofessional teams? It was an eye-opening number. 85% of them have never done telehealth in an interprofessional setup. So that let me really kind of sit up and take notice that this is the area that needs more attention, that it's not just important to teach telehealth in person, teach interprofessional care in person, you also need interprofessional care delivery models and simulations around telehealth. So one more thing I wanted to say for this particular, study is that we made sure that the students, when they did a pre-activity survey, before that, we have sent them materials, but we made sure regarding telehealth, but we wanted to capture what their experience had been before telehealth sessions. So we didn't allow them to kind of review any of the telehealth material. We wanted to learn what are their scores at the baseline, and then we kind of moved from there. So if you are designing post this discussion telehealth simulation setup, do a pre and post, but also make sure to send some material to bring everyone up to speed before they come for the telehealth simulation, but make sure that they have not taken the survey. They have taken the survey before they kind of review all the materials. So this is what our telehealth simulation kind of looked like. We had to make sure that we had an agenda where the students have taken the survey, they have reviewed the material, and this was PowerPoint presentations from all the three disciplines. They also had to kind of read one research article on interprofessional care, and then they would come and be part of this simulation. Before they get into simulation, they go into breakout rooms. So we were kind of dealing with around providing education to 100 students, which is physical therapy, nursing, and social work. So we made them kind of go into breakout rooms, discuss the case, and then come together. And then each of the disciplines will have their representatives talking about, interacting with the patient. So these were the competencies with respect to the simulation that they were trying to kind of get used to in terms of, understanding their own role as a healthcare profession in discharge planning. They also have to learn about other healthcare professionals in the discharge planning, learn how to use telehealth, in that particular setup. So some of the competencies that they were getting used to were the value and ethics of interprofessional practice. What are their own roles and other providers' roles and responsibilities? What are the things that they have to do in terms of interprofessional communication? And what kind of teamwork that they have to kind of perform for the effective discharge planning for these patients? They also had a post-telehealth simulation discussion where they were talking about their respective role and role of other team members. Many a times we realize that the providers, they work in silos. Like, for example, a physical therapist would go and treat the patient and come, write a note, and then, either the nursing and vice versa. So this was a good exposure for students to see how the nursing was taking notes and learning about patients and medications with respect to, and this was a Parkinson's client, so they were interested in gait and balance. But having said that, I think it was an enriching experience for the students because they were kind of really learning how to kind of interact with the other team members. So the dynamics of it was kind of really interesting too. So the outcome measures, we took the SPICE R2, in which they were learning about, the student perceptions of interprofessional clinical education. And the outcomes kind of showed that in terms of patient and client satisfaction, there was statistically significant difference pre and post, So I think what they were learning that, the patient client satisfaction is improved when care is delivered via an interprofessional team. In terms of healthcare costs, they are reduced when patient and clients are treated by an interprofessional team. So that is where also we saw some statistically significant changes. And finally, in terms of the interprofessional team's perception, of preparedness, of what you can call their centeredness around the patient, they also saw that, there was a statistically significant difference between the two. So some of the interesting perspectives that we learned from a qualitative assessment in terms of what the students had to say about the experience was they kind of thought that, to work with students from other disciplines and getting their aspect of healthcare was important. They also said that we have something different that we kind of bring to the table. And they learned that, when we work best is when we work together. So that is the culture that they were trying to kind of imbibe through that activity. Some of them said it was illuminating to see PTs conduct their assessments and observe their line of questioning, because that gave them an outlook of what a physical therapist does in that profession. Understanding the exact roles of other professionals to collaborate together in making goals and plans together was also fruitful for the patients and outcomes, but also was enriching for the students and their ability to learn or hone the skill of interprofessional care. So in terms of talking about telehealth-based interventions, I have kind of used an mHealth platform, and we kind of provided care for community dwelling older adults using an mHealth platform in which, and we were using Blue Marble Health games. And in this one, this has a platform in which you can track not only just motor assessment, and this is actually, you can even do COPD assessment, and you can kind of have the track of, whether they can keep a diary of what are the changes that has been happening, or you want to kind of provide education modules, track progress, or standard self-evaluation. So this product is from Blue Marble Health, and I have no financial association with them, but it is just a research collaboration that I have with them, that we use their product for our research. So another thing I want to talk about is a study which kind of talks about cortical priming during telehealth session. This was DigiPrime Games. And what they showed was that in terms of providing telerehabilitation, they were doing a priming, and then they were kind of doing a functional exercise training. So what they found was that game-based priming really kind of facilitates the priming effect in people with stroke. So this was a neat exercise to kind of, our study to kind of look at, because they were doing telehealth session, but they were also seeing benefits very comparable to what they saw in person. So telehealth in a hybrid world, I feel that we are moving more and more and becoming more and more comfortable with a hybrid world scenario. So I think, if there are people who are still on the cusp of using telehealth, to them, I would say that if you want the criteria of how you can make the decision whether your client is appropriate for telehealth, I would say your basis should be on a variety of factors. One of them is the age of the client, the type of the disorder, whether it is stable or unstable, what kind of support or family caregiver support the patient has, what kind of motivation, level do they have to recover. And then in terms of access to technology and viable internet connection, very, very important. And again, if we are not meeting those standards, what are the things that we can do to make sure that we can have our patients connected to us? So how can it become part of a healthcare ecosystem? I feel that, planning a session, especially in a telehealth space, goes a long way. You have to kind of include and make sure that if you are working in a healthcare setting, in a hospital, a telehealth coordinator can really help things set up for you so that the patient has a seamless experience. The provider is able to kind of do things that they feel confident of when they are kind of providing those aspects or care. Education of clients and clinician goes a long way. So I feel that, what we are doing today is very important, but nevertheless, I think that we need to have those education material modules being there in primary care providers' offices, in various aspects of if the patient is going to see a nurse practitioner, and they can watch those videos, they can see how the telehealth is being delivered. Maybe there's a way of connecting with the providers so that you are meeting them for not an urgent purposes, but initially, getting yourselves accustomed to how the telehealth works. So I want to quickly talk about digital innovation, especially virtual reality and remote therapeutic monitoring and mHealth apps that I have experience using. And I think some of them have kind of really helped me optimize my capabilities in terms of providing the best outcomes to my patients. So I'm very much interested in, the role of virtual reality and augmented reality with using artificial intelligence in the area of telerehabilitation. So if some of you kind of share the same passion, I would love to kind of connect with you to see what we can do together. In terms of virtual reality and augmented reality, for some of us who may not know the difference, the virtual reality is, it's a more immersive experience versus augmented reality. You can think of, you still can see the real world, but you may have some superimposition of some aspect that will help you, let into the augmented reality case for that matter. I feel that virtual reality, especially in the scope of telehealth-based physical therapy, is kind of, I think, creating a lot of, I would say, disruption. And I feel in a very, very, I would say, phenomenal way of providing a care. Especially, I'm seeing that in being used for veterans and in veteran healthcare systems. I personally am using virtual reality for my Parkinson's patient and having a lot of success with that. So this is a virtual reality headset I'm using that is with this company called Neuro Rehab VR. And it is kind of a very neat platform, I would say, that it helps you kind of learning and it provides you, various aspects of what you can do with the patient. So whether it is with respect to neuro clients, or whether you want to use it for pain management, whether you want to use it in, I would say, I think they also have some model in which they are working on mental health aspects. So here is, a small video of what I have done with my patients. Forward and forward, both of them. And bring it back. Good job. Bring it forward. Okay, and bring it back. Good job. Now this time, bring it forward. And then can you raise them up as much as you can? And then bring it back. So this is the Parkinson's client who came to me with very, I would say, freezing of gait, not being confident and not being able to kind of stand for so long. And within, I would say, 10 sessions, this he was kind of really confident. Prior to Parkinson's, he was a boxing coach, but, there's a lot of things happened, especially with Parkinson's, and he lost his ability to being confident in his balance. So virtual reality, along with, I would say, physical therapy was really, I think, a game changer for this individual. So something to kind of think about in terms of, providing care and making sure what are the things that you can do to optimize outcomes. Put your hand forward. And so another mHealth platform that I have used and I have told earlier is Blue Marble Health. I would say that, they have an excellent feature for something called as Health in Motion, in which you can actually provide a gamut of exercises. You can write that, you can put that in your patient portal, and, they'll open the app and they are able to do those exercises along with an avatar. So we published a study using their app. And what I was trying to kind of understand is, does the self-reported digital fall risk assessment is comparable to what I do, I have done traditionally in my gait balance and mobility clinic while I'm trying to do functional balance and gait assessments. And anyone who has done that would know that it takes solid 35 to 40 minutes to complete that assessment, which is a pen and paper based assessment. And here we were using an app which is giving us the comparable, data in terms of 30-second sit to stand, one leg stand test. And here, with the app, we were spending 7 to 8 minutes. So just cutting down on the time of doing an assessment, which can give you a good overview of where your patients are at in terms of a balance, in my opinion, was really helpful, because, that can really change the capacity of how many patients you can evaluate and how many patients you can actually treat if you know that they are at fall risk. The other aspect to the study was, how can I make the seniors being more independent? How can I help them take charge of their own health? And that is something I thought was, really revolutionary, that the seniors can do their own self-assessment of their balance if you train them. And then over the period of time, you can track the data on seeing how they are doing. The another, I would say, currently I'm using a remote therapeutic monitoring app called OneStep. And OneStep is kind of allowing me to provide the smartphone-based, it's a smartphone-based application for various gait conditions in, healthy adults with feasibility, the study that they have published. But what I'm using it for is my patients with Parkinson's and also Alzheimer's. It was kind of very neat to have that data and see, how you can track the data. For example, it gives you a score, and it gives you an ability to track the progress over the period of time. So this was actually very helpful, because I can see what my patient's walk score is over the period of time. So here, I saw that, they were starting somewhere between 70, 60, and 80. And then, they are kind of hovering, but there are incidences where either they had a fall or they were not doing well, and then their scores dropped. So that way, when I'm creating a home exercise program for them, I can actually create a personalized program for them. And it is not just a black box of giving an exercise at the discharge and then just hoping that they are doing the exercises that we told them to do. Or what if, their abilities have changed and maybe they need more on some aspect of their balance versus another. Another thing that this app allows us is to, you can see them over the period of time. For example, here you see that, I provided it on August 3rd, that they kind of had their walk scores tested, and then they also had a walk score at October 22nd, and the changes that you see in their ability and their walk score. So like I said, it allows you, the OneStep app allows you to kind of have the video-based home exercise program. So based on my patients' outcome measures, their baseline data, I can actually create a home exercise program for them. And I see when they are kind of following it, and they can also give me feedback and then text me inside the app to let me know, how it is going. The last aspect I want to kind of touch, which I am very interested to kind of learn more, is how to use artificial intelligence. I feel that, the paradigm shift that artificial intelligence is bringing in a healthcare landscape is something that we should be very, very mindful of. At the same time, make sure that we are ethical in kind of creating the apps, and we are kind of transparent in what kind of data we are collecting, and what kind of privacy, features that we can provide to our client so that they feel more confident in the apps that we are creating. So this one study actually talks about, how the artificial intelligence application was being compared to a physical therapist kind of doing an evaluation for squatting. And the results was that it was very comparable with terms of, assessment. I personally feel that in terms of data-driven insights is the way to go in the healthcare, because the way that things are changing, I feel that even clients and our end users want to know what they are improving, how they are improving, and what can be done to change those things which are not improving. So having an objective data goes a long way, and it will really help us, hone our ability to provide even telehealth for that matter. So in summary, I would say that in terms of healthcare and training and the approach that we need to take is more of a practical immersion. I feel that with technologies such as virtual reality or metaverse related healthcare education, we can give those realistic scenarios and help our students hone in, the decision-making aspect to providing care. A more collaborative training would enrich their experience as a provider and as a student, and that would help in kind of creating a better, I would say, framework for care for our patients. And again, I think the inclusive access in which, the remote simulations are breaking down those barriers, of the geographical barriers. So maybe the learners from different parts of the United States, or somebody sitting in Africa can leverage what we are doing here, can be a game changer for our industry. So that being said, I think I feel that the way to go in the future is to make sure that we are doing things in a very ethical and logical manner, and making sure that we have guidelines and principles around these spaces in terms of technology. We need clinicians at the back of technology. I still feel that no matter how smart the technology becomes, we need that human connection behind it. So thank you so much. And if you think if I can ever leverage my expertise or my experience, I'm always happy to connect. Thank you.
Thank you so much. I'm just going to second, as she presented, please connect with her. She's a great person to know on LinkedIn. Great insights always shared, very active. So yes, I just want to say this presentation was wonderful. There were a lot of great considerations shared, best practices shared. So I hope everyone in the room will revisit this and share with our friends. I do want to bring up a few quick slides during this time. If anybody has any questions or comments, now is your time. I just want to quickly touch on a few things for CTRC of what is coming up, especially given that AI was mentioned and strongly discussed. In December, we're having an office hour. It's going to be pretty much focused on payment and regulation updates for 2024. Very timely. I know everybody's interested in this. There's a lot of changes happening, so please join with us and learn about that. But what I'm very excited about that is going to be launching in 2024 is CTRC will be hosting an 8-part series focused on the role of AI in digital health services. Doctor, we would love to have you participate and join us on these conversations. Also, everybody in the room, please listen in, learn. If you're interested in participating, reach out to us. We are really excited about this topic and what is being done in this space. And the TRCs have been tasked with kind of leading education in this area. So if you're interested and would like to be involved in this, we'd love to work with you. And yeah, so that's it. But again, if you have any questions, now is the time. I do see one in the chat from Hallie. I know we talked about a lot of good kind of considerations and thoughts when it comes to training and providing these services. But Hallie is asking, when it comes to departments looking to implement virtual services, is it a better approach to review the in-person services and physical exam requirements and then match them to the tech capabilities, or look at the tech possibilities first and see how they could apply to those practices?
So thank you, Haley, for asking this question. And I would say that, the answer is it depends. I feel that it's also the capabilities of the infrastructure that you may have at the institution that you may be kind of providing the virtual care. So I think, and also the capabilities from the patient end. So I feel that my personal approach is, what are some of the outcomes that I need to gather to have that insight before I can implement a treatment intervention? So doesn't have to be a gamut of outcome measures. What are the few outcome measures that can really give me that data to make that decision? So if that matches with what I can deliver, then I will go with that.
Great thoughts. I agree. Any other questions at this time? We'd love to have them. We got a little bit of time.
And also feel free to reach out, and you can reach out to Iceland and or myself, and if there are any post thoughts from this discussion, I'm more than happy to kind of connect or answer and be that mentor if you need me.
Great. Thank you. And yes, CTRC is here for you also. We're here, we're federally funded, we're state funded. Reach out to us, we want to help you. Okay, I'm not seeing any more questions come in at this time. Doctor, I just want to offer if you have any final words for us before we close out.
Yeah, I think another thing I would say is that reach out to in your circle. For example, if you are at an institution where you think that maybe you are the first person kind of thinking about telehealth, I would say, just have a discussion or a group meeting in which you can find people who are supporting or supportive of that venture, and start something small and safe before you get into kind of doing with patient populations, so that I feel the students are confident, you are confident, and having a safe setup. So I would say starting small and starting with some people who are supportive of the idea could be the way to go about it.
I love that. I couldn't agree more with leaning on what you have in your community is great. Thank you so much for being here with us today. We appreciate the insights and conversation you brought to our network here, and we hope to hear from you again soon. So thank you for your time today. Thank you to all our participants for being here, and we hope that you all have a wonderful holiday weekend. So yeah. Thank you.